Dr. Daria, and keeping your family safe starts with keeping children out of medications. Every year, 60,000 children end up in the emergency department because they took a medication that they weren't supposed to. So I want your family to not be in the ER for that. So there are 3 things that I want you to do. Number 1 is put it away. Over 50% of kids that got into medications did so because their parents were very careful about medications the rest of the time, but the parent took out a medication to take it, got distracted, and left it on the counter for just a few seconds, which is enough time for the toddler to get into it. Number 2 is grandma's purse syndrome. About 60% of toddlers who got into medications got them from their grandparents' supply. And think about it, grandma comes over, sets down her purse with a little handy daily medication supply in it. Child gets into it just a few minutes later when nobody's looking. Lastly is what I call triple layer protection. That means store all medications in child-proof bottles, put them in a high place that's out of reach and out of sight, and lock that cabinet where you keep them. If you do these things, you'll be sure to keep your children out of medications and out of the ER.